The humeral head is 4 times the height of the glenoid fossa. What structures keep this humeral head centered and stable within the glenoid? Well, surrounding the shoulder joint, you have active and passive tissues. The passive tissue, known as the joint capsule, is thick fibrous structure that surrounds the entire joint. The active tissues, the muscles, and tendons in the rotator cuff surrounding the shoulder joint can actively contract to keep the shoulder stable. If the active and passive structures are not keeping the shoulder stabilized perfectly in the socket, the shoulder can move out of place, often gliding forward and causing pain in front of the shoulder. If you suspect that your shoulder is gliding forward or is unstable, a medical practitioner may perform a joint centration test. Let's take a look to see how this test is performed. The test for humeral joint sensation. We are going to place a towel under the distal aspect of the humerus, and then we are going to ask the patient to internally rotate their shoulder towards the ground, and we are going to make sure that the humerus stays in that position. The shoulder stays in the exact position, pressing down against the table as they rotate their arm down. That was an example of a centrated humerus. That was a negative test. A positive test would be if the patient goes into internal rotation, but the humerus glides anterior away from the table, just as you can see here, separating from the table, creating that space. The key to this test is observation and timing. A positive test is a shoulder that glides forward with or without pain. The glide occurs during the end of the motion. It's likely caused by a stiff rotator cuff muscle in the back of the shoulder, either infraspinatus or teres minor. If the glide occurs early on in the motion, oftentimes during the first 50% of the range, it's a likely cause that a poor motor coordination is present.